So we're back with part 2 of medical terminology. We're looking at special word parts with number prefixes. So when you are defining a number, there are special terms that define those numbers with medical terminology. So we'll go through several slides here and look at these. So these are number prefixes. So they would come before the root word. So uni, U-N-I, means one. An example would be unilateral, which means one side. So for example, if someone is having a stroke, they might have unilateral weakness or unilateral paralysis, which would indicate weakness or paralysis on one side of the body. Okay, so number 2 there, the second word is D-I-P-L, which means two or double. An example of that would be diplopia, which means double vision. So it's a combination of two combining forms. So you have the DIPL and the OPIA, which are both combining forms, which combine to make double vision. The next term, our next prefix is NULL, or null, meaning none. So an example of that would be nullipara, which means that a woman has never given birth. The next word is PRIMI, or primi, meaning first. An example of that would be prima gravida, which means the woman is pregnant for the first time. The next word, multi, which means many. An example of that would be multiparous, which means that a woman is giving birth to more than one offspring at a time. So that would be like multiple births, like twins, triplets, quadruplets, etc. The next prefix is bi, bi, meaning two. An example of that would be bilateral, which means pertaining to both sides. So for example, if someone has bilateral weakness, that would be very different from unilateral weakness. The next term, tri, means three. An example of that would be trigeminy, which is irregular heartbeats of two or more normal beats followed by one premature beat. The next term on this slide is quad, meaning four, or quadriplegic as an example. And it means a analysis of all four extremities. Paralysis of all four extremities. So as we continue on with number prefixes, we see tetra, which means four. An example of that would be the condition called tetralogy of Fallot, which is a congenital birth defect involving four anatomic abnormalities of the heart. The next term, quint, meaning five. Quintipara would mean 5 pregnancies resulting in 5 live births. Sexty, meaning 6. An example of that would be sextuplets, and it would be 6 offspring of the same pregnancy. Oct, or OCT, meaning 8. An example would be octogravida, which would mean pregnant for the 8th time. The next term, nona, N-O-N-A, meaning 9. An example of that would be nonen, which means occurring on the 9th day. The next term is deca, meaning 10. An example would be decagram, which would be measurement of 10 grams. Semi, or semi, either way is correct, meaning half or partial. An example would be semi-conscious, and that would mean partially conscious. Hemi, H-E-M-I, meaning half or one-sided. An example would be hemiplegia, which means paralysis on one side of the body. Ambi, or both, meaning ambidextrous, would mean able to use either hand equally well. And pan means all or entire. So, for example, pandemic would mean an epidemic over a wide area. So next we look at special word roots special word parts that describe color. So the first root word we see there is cyan with a combining vowel, meaning blue. An example would be cyanosis, or bluish color discoloration of the skin. The next word, leuk, L-E-U-K, with a combining vowel, leuco, combining vowel of O, pronounced leuco, means white. An example would be leukocyte, which means white blood cells that fight infection. Next is erythro, meaning red. An example is erythrocyte, which means red blood cells that contain hemoglobin to carry oxygen. The next word is C-I-R-R-H-O, cirrho, meaning a yellow-orange color. An example would be cirrhosis, and this is inflammation of the liver causing a yellow-orange pigmentation to the skin. The next word, melano, indicates black. An example of that would be melena, and that means black tarry stool typically caused by upper GI bleeding. The next term, polio, meaning gray. An example of that is poliomyelitis, which is an acute viral disease that attacks the motor neurons of the central nervous system. The next word, ALB, indicates white. An example of this would be albino, which means a person lacking skin pigmentation. And then the last word on the slide is chloro, meaning green. An example would be chlorophyll, which means a green pigment in leaves used in photosynthesis. So next we're going to look at several slides which indicate prefixes that describe position. So if we're trying to describe to or from, we have two prefixes for that. AB, or ab, meaning away or from. An example would be abduction, which means away from the point of reference. We have ad, which means to or toward. An example of that would be adduction, which means toward the center. If we're trying to describe above, below, or around, we can use these terms. DE means down from or away. An example of that would be decay, which means to waste away. The next word is CIRCUM, circum, which means around or about. An example of that would be a circumferential burn, which would mean a burn around an entire area, such as an arm, the chest, the abdomen, a leg, or etc. Next is peri, which means around. An example of that would be pericardium, which is a sac that surrounds the heart. The last word on this slide is trans, which means across, through, or beyond. Transvaginal is an example which means across or through the vagina. If we're trying to describe above, below, or around something, we have several terms, several prefixes that can describe this. Epi or EPI means above, upon, or on. An example of this would be epigastric, which means above or over the stomach. Supra means above or over. An example would be the suprasternal notch, which is on the top of the sternum. Retro means behind. An example of that would be retroperitoneal, which is the area behind the peritoneum. Sub means under or beneath. An example of this would be subcutaneous, which means beneath the skin. Infra means below or under. Infraclavicular means below the clavicle. Para indicates near, beside, beyond, or apart from. An example would be parasternal, which means beside the sternum. And contra indicates against or opposite. An example of this would be contraindicated, which is something that is not indicated. And if we're trying to trying to describe outside or inside, we have several prefixes that can be used. Ecto means out or inside. An example of that would be an ectopic pregnancy, which is a pregnancy where the embryo attaches outside of the uterus. The prefix endo means within. An example of this is endoscopy, which is examining inside someone's body with an endoscope. Next is extra, which means outside or in addition. An example of that would be extraneous, meaning outside the organism and not belonging to it. Next is intra, which means inside or within. An example of this would be intrauterine, or within the uterus. And then the last term is ipsi, which means the same. An example of this would be ipsilateral, which means on or affecting the same side. So we're going to look at directional terms here. And this is a very busy slide. However, I'll take my time in going through it. We look at, first thing to understand when you're looking at the body, the human body, is the anatomical position. The anatomical position is as this figure is standing here. The body is standing up, the body's erect, means standing up straight, with the palms out. The palms out make all the bones of the arm that are not crossed over, such as the radius and the ulna, which we will get to much later in anatomy and physiology. But in the lower arm, there's two bones, and if the palms are facing backwards, those bones are crossed over each other. If the palms are facing forward, like in the anatomical position, they are straight and not crossed over. So it's important that you know what the anatomical position looks like. The next term I have there is superficial, which means closer to or on the skin. So if someone has a superficial laceration, it means that it's a small sort of laceration, maybe something that maybe someone's cat may give them if they were scratched by their cat, or a really maybe cut with a knife, and it could be superficial. The next term is deep, which means farther inside the body or away from the skin. So this can be, for example, a deep laceration, which might be done with a very sharp knife, and you can have a very deep laceration that goes far away from the outside of the body toward the inside. So as we look at the diagram here, I'm going to be going from the top down, and one of the things that's very important to understand is when we're referring to right and left, we always refer to the patient's right and left, not ours. So it's important that you understand that as you're looking at somebody, your right and left, their right and left are opposite. So anytime you're describing right and left, it's always the patient's right or left. At the top, we have the terms medial and lateral. Medial indicates closer to the midline of the body. So if you drew a line down through the very center of the body from the head, where this gold line is being drawn, it means toward the midline of the body. The word lateral indicates away from the midline of the body. And then as we move down, we see the term posterior or rear. Another term for that is also dorsal. We don't use dorsal and ventral very often, but there are places where you may see that. So one of the ways that I have always remembered dorsal is that with a fish, they have a dorsal fin, which is always on their back. So that's the way I remember that. However, we use posterior usually for the terminology for this. But and then we have the opposite of posterior is anterior, and we see that listed on the patient's chest here. We also see ventral, which is the opposite of dorsal. So we have front and rear, or anterior and posterior, or ventral and dorsal. So all of these are correct, but most of the time you will be using anterior and posterior for these terms. Next, we see the term next to the patient's head. We see superior, which means nearer to the head. And then at the bottom, we see inferior, which means away from the head. So this can be used to indicate a lot of things on the body that may be indicated as superior or inferior. Looking over on the patient's right, we see the terms proximal and distal. Proximal and distal are typically used when referring to extremities with things that are either further away or closer to the body. So if something is closer to the body, it's proximal. So for example, the elbow is proximal to the wrist. Going the other direction, distal, or you can think of it as maybe distant, distal is further away from the body. So the elbow is distal to the shoulder. So that would be one use. And then looking over on the right side of the slide, we see two more terms that we don't use very often, but they are out there. Palmar, which is referring to the palm of the hand, and plantar, which is referring to the bottom of the foot. So you may see those out there in the medical terminology. So looking at movement terms, we have the first, the diagram on the left indicates flexion and extension. So flexion is moving a body part toward, it's usually referred to as with a joint that is moving a joint closer, decreasing the angle of that joint. So it's flexion, as you can see with bringing your forearm up towards your shoulder is flexion, and extending that is extension. In the other diagram, we see what I refer to as abduction and adduction. Abduction is taking a joint away from the midline of the body. So this is showing the shoulder with extending the arm out to the outside. So this would be abduction. Adduction would be bringing that arm back in towards the midline of the body, toward the center line of the body. And I remember these two by, with adduction, you're adding to the body. You're bringing something closer to the body, so you're adding to the body. And then the opposite with going away from the body is the abduction. We have our abdominal quadrants, and we will learn in anatomy and physiology, we will learn what are in these quadrants. So they are listed here, but I'm not going to cover those right now. But the abdominal quadrants are divided into four areas or quadrants. That's why it's called that. So you have the right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. And we will learn certain organs that are typically in these quadrants when we get into anatomy and physiology. But it is important at this point that you understand the terms of the terms of the abdominal quadrants. Some terms that identify anatomic positions further are supine, which you see the patient here is lying on their back, so that is referred to as supine. If a person is laying on their stomach or on their chest, it's referred to as prone. And then lying on their side is often called, in CPR class, first aid classes, we refer to this as the recovery position. More specifically, it's referred to as the left lateral recumbent position with this particular picture, or it could be a right lateral recumbent position. So where you might find this is if you find someone when you first find, say, an injured or an ill victim, and you're trying to describe how they were lying, you might describe that they were lying in a right lateral recumbent position or a left lateral recumbent position. The Fowler's position simply means a position where sitting up. So we see with the person on the cot, this is sometimes referred to as a semi-Fowler position because they're not sitting completely straight up. And then you see the lady on the right is leaning up against the wall, and she is generally sitting almost straight up, so that would be a full Fowler's position.